episode is going to be about models of mental health and therapy in particular. So, there have been, for a while now, two major models of mental health. The first one is the medical model, and that's the one that's been around the longest, more of like the old school approach. And the second one is the wellness model of mental health. So, I've done a blog for my website about this a couple years ago, and it's the highest ranking thing on my website, which I kind of found really interesting and random, but it made me realize like not a lot of people are talking about this topic, and people are more curious about it than I anticipated. So I wanted to do a video to talk a little bit more about it. I think this video could be relevant for people who want to start therapy, but obviously since this is a channel for therapists, it's going to be very relevant to therapists as well. So whichever side of the coin you fall on, like, welcome, and let's go. So first, the medical model of mental health. This is, like I mentioned earlier, a very old school approach. It's basically based off of the way regular medical care works, right? So if you're sick, you go to the doctor and you go through whatever course of treatment they tell you. And then when you're feeling better, or when the medication stops or whatever it is, then you're done. And you don't go back until you're sick again. So that's pretty much what therapy was for a long time. You have a crisis and you go see a therapist, and then you work through the crisis, and then you stop therapy. And while I think for certain cases that could be really effective, it's not that way for most people, I've found. So there's a few different pros and cons to the medical model. I think some of the pros might be it could be very solution focused if somebody's going through a crisis or a specific loss or trauma or something along those lines, and that's what gets them into therapy, and that's the singular thing that they want to work through, and they go through an EMDR protocol, they go through some sort of like brief trauma focused therapy, some kind of like model based therapy or protocol type therapy, then that might be all that they need. If they were not experiencing any mental health issues before, they didn't have anything unresolved, they might be able to go in and, have therapy for a couple months or address the one issue and be fine. And that might be great for them. So that could be a pro if it's something you just really needed short term, and the therapist you were seeing or working with they really abided by that very short term model of seeing people. But to me, that's the only pro. So typically the medical model, that was formed by insurance companies. So insurance companies would say, we're going to give this person 5 sessions and let's see if they get better. And if not, then you as a therapist can put in, or them as the client can call and try to get more from us, and then we'll decide what to do next. So it was very much like financially based. It was corporation based. It was kind of like a lot of the insurance companies just didn't want to pay, so they would limit the amount of sessions you could get. So in the past, people would be super limited financially on what they were able to afford, and for some of them, not knowing anything different, they just assumed like, well, if I'm only going to get 5 sessions, or if I'm only going to get 10 sessions from my insurance company, then maybe that's all I need. So, or they felt very restricted by it. And it's the same for therapists, because sometimes it takes a while to build rapport, or somebody thinks they're coming in for one issue, but as you're talking through some things, you figure out that they've got some other stuff going on, and they might need more than that. It might take the first 5 to even get like their whole history and begin building that rapport and the treatment plan and stuff like that. So it's not that quick and easy. And so I think that it can be very frustrating to deal with that medical model, because it's kind of outdated, and mental health providers didn't create it. It's very much a doctor insurance kind of system. So I think for me, I personally don't abide by it. I don't really like it or believe in it unless it is, like I said, very random, rare, kind of one and done sort of thing somebody's going to treatment for. And yeah, I just feel like it just takes away when corporations or insurance companies are making decisions that are medical decisions and not including the client or the provider in it. it just feels really, honestly, kind of gross to me. And I've seen a lot of clients in the past have battles with their insurance companies, or I've seen providers have battles and spend hours on the phone with insurance companies trying to justify why somebody needs more. I've also noticed that a lot of older generations of people have more of that medical model view because that's what they grew up with, and that's just what was known to them, and that's what was expected. So it might be like, oh, you're going through a hard time. If they're even open to suggesting therapy, it might be sort of, again, like, you feeling better yet, or sort of one and done. Like, one round of treatment, which might be a couple months of therapy, and then they think that person's good to go. So to me, again, don't love the medical model. Unless you're doing some specific protocol, I don't really love that way of looking at it. And I think a lot of clients don't love that way of looking at it either. So there's sometimes a lot of frustration or shame that can come. If that's the idea in their head of how therapy is supposed to be, it can be hard for them to want to have more therapy. And that's where some of that like shame or frustration might come in, of feeling like they can't. So make sure as a provider, if you're providing more of that brief type of therapy, that's what you're describing on directories, your website, while you're networking, stuff like that, so that you're not catching clients off guard and you're putting out there exactly what to expect from sessions. I know that you can't say how long it's going to be for each person, because it's very different, unless it was something like a sleep hygiene clinic, and you're going to do these 5 sessions because it's 5 different workshops or something along those lines. I mean, for like individual, like ongoing therapy, you probably can't put out a specific number, but you can definitely say like, here's my focus. So that way if people are looking for that, that's more of what they'll go to. That's what they'll find and search for. So the way that I view therapy is the wellness model of therapy. So essentially what that means is therapy is just another thing on your list of ways that you take care of yourself. It should be as normalized as working out and eating healthy and drinking water and getting sunlight and like all the other wellness things that we do or we're supposed to do. And therapy belongs right in those categories. So the wellness model of therapy is still fairly new, because a lot of people weren't talking about mental health for a very long time. And if they were, it was in terms of like a major crisis. Or I know a lot of therapists will use the terms like big T trauma or little t trauma. So little t maybe would be like a car accident where nobody was hurt, but you were really caught off guard and it made you really nervous about driving. Where big T might be car accident where you saw somebody pass away, you were severely injured, like stuff like that. So just the severity might differ a little bit. But sometimes people, for the longest, they thought that like you needed that big T trauma to go to therapy. Like you needed to have something that was severely wrong, some huge issue, something on like a grand scale to go to therapy. It couldn't just be like, I'm feeling kind of anxious, or I'm sad a lot of the time, or I've been really lonely lately, or I want to get out of my relationship, or whatever the situation was. People thought, because of that medical model of therapy, that you had to have some major issue to go to therapy. And anything that's impacting your life is going to be a major issue, even if you're not classifying it as such. So when you think about what your wellness practices are personally, and then you think about as a therapist what type of things you're talking about when it comes to wellness, therapy should be right in the middle of all of that. So I think it should be as normalized as, like I said, going to work out, eating healthy, having great social interactions and good boundaries, and like all the other things. So the wellness model is basically saying that instead of this like quicker, short-term type of therapy, people can go to therapy for not only any issues that are impacting their life in some way, but they also can go to therapy for maintenance from those issues, and there doesn't necessarily need to be a set end date. So a lot of times insurances have gotten a little bit better as far as like restricting sessions. Not all of them, but a good amount of them have, which is nice because they're kind of trending a little more towards that wellness model. But I think for the clients and for the therapists, to be able to normalize mental health, especially if somebody's coming in with their own stigmas surrounding it, or if you've had your own. I've seen in a lot of therapist Facebook groups, somebody who's newer will say something along the lines of like, well, how long should a client be in therapy for? And the comments vary so wildly. And it's very interesting to me because typically most people are like, oh, as long as they need to be, and as long as they're getting something out of it, and as long as they're benefiting from it and it's helping their life in some way. And then you'll have a small group of people say like, well, I was trained, or well, I believe, and whatever it is, that like you need to get all your clients out of there, and you need to get them to the point that they're self-sufficient and they're not codependent on you. And they get really mad and judgmental about the therapists that do longer term therapy. And I think it's because they were taught that medical model. And so they're seeing anything that feels like maintenance as like the client being codependent. And I completely disagree with that. So I think for the wellness model, you wouldn't say like, well, I went to the gym and I hit the goal that I wanted to for push-ups, so I'm out. No, you would say, okay, maybe I don't need to go as hard as I was going before, but I want to make sure that I'm maintaining my ability to do that many, and maybe even push a little bit more and see what the next goal is. And it's the same thing with therapy. Some people might come in for one specific issue or stressor, but as they start talking and they realize like they're feeling better, they're learning more techniques, they might want to still keep coming to therapy to talk about their goal setting, to have somebody that's helping hold them accountable, that's increasing their self-awareness because they've got that time once a month, twice a month, whatever it is, to sit down and really focus on themselves and what they need, what's going well, what they can work on. And so I personally provide therapy that's along those lines. And the majority of people I see have like high functioning anxiety, which means that their anxiety is not necessarily impairing them from doing their job or from some of their relationships, but their anxiety is causing them to be extremely hard on themselves, to push themselves to be successful, even at the expense of their own needs. So that wouldn't necessarily be something that you could figure out quickly in a brief model. That would be something that you might need to do. You might be doing 30 years of assumptions and biases and training and parenting and all this other stuff that people have gone through. So it's going to take some time. And a lot of my clients stay with me for years, and the frequency goes down though, right? So somebody might start therapy and be like, I got a lot going on, and you see them weekly for a while, and then over time they're doing better and they go down to every other week. And then maybe for a while they're doing better and they can only do once a month, or they only need once a month to just kind of check in 1 hour a month to make sure that they're on the right track, and to share their wins and to discuss like what's gonna happen for them next, or what hiccups they had that month, or whatever else. And then sometimes people go to every other month, or kind of check in quarterly, or whatever it is. So I think that old model is, again, it's outdated. And for you as a newer therapist, or starting your practice, or whatever different part of this field that you're in right now, really think through how you do your best work. Do you prefer kind of the brief type of therapy? Maybe then you need to be in a clinic or like a hospital type of setting that just works faster, and you've got the person for that 30 days they're in treatment. If it's like a rehab type place, or maybe you've got them, you have your own whatever thing where you're focused on a specific type of therapy. Maybe it's like ketamine assisted therapy or something, where they've got this set amount of treatments that you do in this protocol. Maybe then you've made good relationships with therapists who are more long-term therapists. So if the person wants that maintenance work, then they can go to a therapist who will sustain that. And just like on my end, some of the therapists are more wellness focused. If somebody ended up having some kind of major trauma where I thought this specific protocol type of therapy would work, well, then I would send them to that therapist temporarily, and we could coordinate on their care overall, and then they would come back to me afterwards. So there's room for everybody, but make sure that you're not bringing your biases into the therapy space. Like I said, these Facebook groups are go wild out here, and these people get so judgmental, and it's like out of control. So you do what works for you, because there's gonna be something that works for every client, and people who can provide both types of therapy and everything in between. But if you've noticed that you have any kind of stigma surrounding that, like people being in long-term therapy, or you're frustrated by that or whatever, figure out why and then work on that. And if you are more of the wellness model, like I said, kind of keep operating the way that you want to, but make sure that you're telling clients what that process looks like, so that way they understand that if they are doing better, they can scale back their sessions. They can start decreasing the frequency if they want to, or if they're at a point that they're like, I'm doing pretty well, I don't know what to talk about today. Then you can talk to them about what's going well and help reinforce that. And then you can talk to them about going down in frequency if you want to. So there's some people that this is literally the only time they have all month to sit and focus on themselves. So, and to start, you may be one of the very few supports that they have on this journey, and you work to help them get more so that there is no risk for codependency with you, and you keep your healthy boundaries with them. But I think that wellness model of therapy needs to be present, and I like that there's an opposition in a sense, but it's more complementary than anything, but with that medical model. So if you are on the client side and you're feeling bad about, oh, I've been in therapy for years, it's like, I think the conversations around that are changing, where more and more people are like, oh, cool, that's awesome that you've had like the same therapist for years, or that's awesome that you're working on yourself, or, I hope I can tell you're getting a lot out of it, or whatever other positive feedback, because there's really no like wrong way, like, oh, you've only had 10 sessions, or oh, you've been seeing the same therapist for 10 years. Like, let it be. If the client's benefiting, the therapist has a healthy relationship with them, whatever, like, let it go. But I think it's very helpful for you to understand what your model of therapy is going to be as you move further in your career, and you can change it if at whatever point it's not working for you. You change populations, modalities, whatever else. And then on the client side of things, I think it's very important to understand what you want going in. And if you want more of that wellness model, you want more of like I want to talk about my goals. I want the help with staying on task and figuring out why certain things are harder for me than others. And, I want those maintenance sessions. Like, I'm doing better, but I want the maintenance sessions, having some of that language to be able to share that with the therapist so that you can get the most out of your sessions and really get what you want and need out of it. So I hope that explains it. I think there's a lot of other layers to it, but that's sort of the basics of each. And like I mentioned earlier, on the therapist side, definitely understand where you're coming from so that at the consult call or the intake, you can clearly explain to the client what therapy with you is going to look like, because it's going to be different than it would be with anybody else. And understand like how you do your best work and then act accordingly. And then on the client side, making sure that you are understanding a little bit more about what you want, and maybe have now some more of the language to figure out if that therapist is going to be a good match for you as you're narrowing down your search. So yeah, hopefully that helps. And I think that this topic should be discussed a lot more. I wish that this was something that was brought up, at least when I was in school, and I haven't heard very many people bring it up in general. But I hope that this is the trend and it keeps going this way, where going to therapy is just something normal that all kinds of people do, and it's widely accepted and even encouraged. So if you want to stay on top of future videos, go ahead and subscribe, and I will see you next time. Thanks.